Hi, my name is Brianne Martin. This is my oral presentation for children with special needs. This is the case study. The child I chose for this case study is an 8-year-old white male. He goes to a charter school, which is a Montessori-based charter school. I chose this child based on a recommendation by his teacher. She's a friend of a friend, and she knew that he'd be perfect for this, and when she described him, I agreed with her. The child has been diagnosed with several learning disabilities. The first is the congenital encephalopathy. Congenital meaning that it was present at birth, and the other is basically a malfunction of the brain. They're not entirely sure what's causing it, but the definition says it's manifested by an altered mental state that is sometimes accompanied by physical changes. He's also been diagnosed with developmental coordination disorder. That's kind of basically describes itself. He doesn't develop normal motor coordination. Children with this have difficulties with basic stuff like catching a ball, that kind of thing. Sensory processing disorder is basically where the senses of the child are not working properly. They're sensitive, way too sensitive to touch, way too sensitive to smell. And the anxiety when they experience excessive fear, nervousness, and shyness, so kind of a constant feeling of doom almost. Asperger's syndrome is part of the autism spectrum disorder, and it's characterized by a lack of social skills and difficulty in social relationships. Migraine headaches, which are just the severe headaches that most people are familiar with, which may also have to do with his sensory disorder. If smells and sounds get to him, it may cause those migraines. And for all of these, it says, treatment plans are available. There's no cure for most of them, but a lot of help by teachers, parents, therapists really seems to do well, and especially with this child has seemed to do well. The assessment I chose was the checklist. I think it's the benefits of it are that it's quick and easy. It can be simple, it can be in depth, but either way, it's very easy. It's a yes, kind of like a yes or no answer. They're mastering it or they're not mastering it. If they're not, you can work a little bit further. If they are, you can move on to something else. It's also something that's easy to send home, where parents can do it without spending an entire night trying to help out with something at home. They can just observe their child doing their homework or reading a book and know whether they're reaching these goals that you want them to reach. The child that I chose, when I observed him in the classroom, socially, I didn't see any issues. The main issue that his mom had pointed out was that dealing with the Asperger's, he has a hard time maintaining and keeping eye contact. And I did notice that, not too anything extensive, but his teacher did tell me when he was speaking to me to make sure he looked me in the eye. With his friends, he did have friends. They liked the World of Minecraft, which I think is like World of Warcraft. I don't know what any of that is, but they had that in common and they loved it, and he seemed to do very well with that. Emotional, the disabilities that he does have can all manifest as emotional disorders. He is very in control of his emotions for anyone, for an 8-year-old, especially for an 8-year-old with some of the things that he's dealing with. He knew when he got frustrated in the classroom, because it is Montessori based, which kind of sometimes is chaotic. There's kids everywhere. If he was getting overwhelmed with the noise or what was going on, he had a signal that he would give his teacher, and he would step out of the classroom, maintain or regain his composure, or whatever the case may be, pet the animals for a little while, and just kind of get back to where he felt comfortable going back in the classroom, and then everything was fine. He also had a tendency to self-talk himself out of negative situations or out of negative feelings, or he just gave himself a quick little pep talk, and seemed to get things under control, which I thought was pretty impressive. For the physical and cognitive, I did not notice any issues. I know that according to his diagnoses, he did have some disorders that may affect his cognitive and physical abilities, but I didn't notice any in the classroom. It's kind of close quarters. Like I said, there's kids everywhere. There's things that can be tripped over, and I didn't notice anything, so I think he's doing okay there. The activities that I chose for the children are rain sticks. just where you, real quick and easy, but can be fun. You get a paper towel tube, stick some nails in there, tape up one end and put rice and beans inside of it, and dry, obviously. Tape up the other end, and then you can decorate it with paper mache, construction paper, markers, sequins, whatever you want. And when you move it back and forth, it makes the sound of like an Indian rain stick. It's very soothing. And that's what I put on here. It's emotional, it can be soothing, it's exploration, art, and social studies. Another way that you can take that a little bit further is to learn about the origin of rain sticks. Another activity I chose was the domino spiral, which I think everybody's pretty familiar with. It's just getting dominoes and setting them up in a line to knock them down. And this is good for fine motor skills. It can sometimes be tricky to set up all those dominoes without knocking them down. And dealing with emotional issues, if you do knock it down before you're ready, not flying off the handle and getting angry. And working well with others, because if you're doing it together, you have to be able to know how to set them up and communicate with each other. And know, we're not knocking it down yet, let's build up a few more. And you can make it in fun shapes and letters, you could spell out words. The next activity I did was, called it a dollar and coins, and basically what that was just finding different ways to make a dollar out of coins, but not just on a piece of paper. You can obviously let the kids feel the coins and see the coins, and one of the things that I found interesting is doing a tinfoil rub and getting, say, 4 quarters, and you set them on the block, and then you get a piece of tinfoil with an eraser, and you just rub the foil, and then you can see the quarter, and then you save those little tinfoil pieces. So you look back and you say, okay, I had this many nickels, I had this many quarters, I had this. So it was just a fun way to find different amounts for $1, and other amounts if you want to. You can do 50 cents. But it's, like I said, it's better than just pencil paper, because they actually get to feel it, they get to see it. And then the last activity I came up with was junk drawer art, which is very successful in my house because we have 5 junk drawers. And that's just taking a piece of poster board, piece of paper, whatever you want, finding batteries, thumbtacks, gum wrappers, little wads of paper, whatever you can find, pennies, and just gluing them to a piece of paper to make designs and artwork, and just using stuff you'd find in a typical junk drawer. For the home and community, I think the biggest strength that I found was the commitment not only by the teacher but by the mother, because they seemed to work well with each other, discussing what this child needed. And the mother seemed very, I think a lot of my friends that are teachers have a lot of issues communicating with parents because they don't really seem to want to get into it. This mother seemed that she cared a lot. She knew all the answers to all the questions, and she's on top of things with her child. And also having the teacher, she wants what's best for all of her students, and you could see that it made her happy to see this child succeeding in her classroom. Finally, like I said, when I first met the child, I didn't know what to expect, obviously, but I was very impressed with him. I just never would have known that he had any kind of special needs whatsoever, especially all of the things that he's been diagnosed with. I kind of wasn't sure how this case study was going to go after meeting him for the first time, because, you know, I couldn't see things going anywhere but up, and actually that's a very good thing. The mother said that he's doing great in this classroom, and he's according to some of his scores, he's actually above the autism levels now, which I think is fabulous. And I think it would be interesting to keep in touch with him and see how he's doing in the years to come, because I think that he's going to be a very successful child. That's it.